Welcome to today's episode. On today's episode, we will be delving into hypertension, a silent killer condition as it's referred to, but it's a common and significant condition. Today, we'll delve into the ins and outs of it and go into the intricacies, the causes, the symptoms, and ways to prevent and manage it. Hypertension affects people worldwide, and I'm sure you may know someone or you are someone that actually suffers from hypertension. So stay tuned and hopefully you may benefit from this conversation. Trudy, let's start off by telling us what hypertension is for those that may not know what it is.
Yeah. So hypertension is actually commonly also known as high blood pressure. So some people really just know it as high blood pressure. And it's basically a medical condition that is defined by a persistent raised arterial blood pressure. So this is, and it's very important to know that arterial blood pressure because it occurs when the force of the blood against the walls of arteries is consistently too high. Now, is a major risk factor for things like stroke, myocardial infarction, heart failure, chronic kidney disease, cognitive decline, and also it can cause premature death. So it is a serious condition. Now, unlike many conditions, hypertension doesn't really have any specific symptoms. And as you said, Steph, that's why it's called the silent killer, because some people don't even know that they have hypertension because there isn't any specific symptoms that you're looking for to sort of like diagnose hypertension. Normally it is diagnosed through regular blood pressure monitoring. And of course, this can be managed by lifestyle changes, medication, or even a combination of both. In most cases, a combination of both is the best treatment for hypertension. Now, just talking about sort of like blood pressure, a normal blood pressure reading is typically considered to be around 120 to around to 80 millimeters of mercury. Now, the top number, 120, is normally known as a systolic pressure. And normally what this represents is the pressure in the arteries when the heart beats and pumps blood out. Whereas the lower number, the 80, is known as the diastolic pressure. And what this represents is the pressure in the arteries when the heart is at rest between each beat, between the beats. So just as a general guide from the NHS in the UK, the ideal blood pressure is normally considered to be between 90 to 60 and 120 to 80, while the target for people who are over 80 is slightly different. So as long as it's below 150 and 90, or if it was taken at home, 145 over 85, then that would be an ideal blood pressure. Now, it will be considered high blood pressure if it is 140 over 90 and above. And if this was taken in, say, the pharmacy, the GP surgery, or any clinics, or if it was done at home, if it was over 135 over 85. So if your reading is over 135 over 85, once you've taken it at home, then that might be considered high blood pressure. Now, as we have said, if you're over the age of 80, high blood pressure tends to be considered if it's slightly higher. It's just because with age, you will possibly get elevated blood pressure. Now, it's very important to note that blood pressure can fluctuate throughout the day, and this would be in response to different factors like stress, physical activity, medication, and many others. So if you and this is very important because we have said it has to be a persistent high blood pressure, persistent raised blood pressure. So if you've done your blood pressure and I don't know, you've just come in from work and it is 138 over, I don't know, 90, then you're a bit worried. Oh my God, I probably have hypertension, I probably have high blood pressure. No, unless it is persistently high, then it would be considered high blood pressure. So a single high reading doesn't necessarily mean that you have hypertension, but consistent high readings may indicate that you need sort of further evaluation and management
Yeah.
by a professional, a healthcare professional. And
Yeah.
it's very important when sort of like checking for hypertension or high blood pressure, you monitor your blood pressure on a regular basis. That is very, very important. And that will also, of course, help maintain good cardiovascular health. Just talking about hypertension and what it is, what
Yeah.
can cause hypertension? What are some of the causes or some of the
Yeah.
factors that could cause hypertension?
Okay. So when it comes to hypertension, I normally say that it's caused by a lot of like lifestyle issues. Um, for instance, let's start off with like, as you mentioned, if you're being inactive. So if you're being inactive, you're at risk of becoming overweight. And being overweight means that you probably have like a lot of like fatty stuff in you. So all of these fatty stuff are gonna basically clog up your arteries, like cause a bit of like resistance, which in turn is gonna increase your risk of getting a high blood pressure. So being overweight, being inactive, definitely a risk factor of getting high blood pressure. Not eating the right food, as I've already mentioned, if you have like a little fatty stuff in you. So not eating the right food as well can increase your risk of like getting high blood pressure. So eating a lot of like fatty foods, a lot of like fast food, that sort of thing, do tend to increase your risk of high blood pressure. So we say obviously eat more fruits and vegetables. Fruits and vegetables are better for your body. One thing also that I'm sure most people are aware of that you normally hear is that too much salt in your food can cause hypertension. Yes, because something that I normally like tell people is that the way salt works is that when you put salt in, let's say, food or something, like you put salt somewhere, water follows salt. So if you're having a lot of salt in your diet, you're gonna increase water in your blood vessels, which increases the pressure. So you're increasing your risk of blood pressure. So too much salt is definitely a major risk factor when it comes to getting hypertension. Another thing I will say is toxins such as like alcohol, smoking. These all puts you at risk of getting hypertension because basically you're putting toxins in the blood vessels, causing resistance, making your heart work a lot harder. So therefore increasing your risk of getting this disease. Unfortunately, as Truda mentioned, age also does increase your risk of getting hypertension because with age, again, your heart needs to work a bit harder. So again, you're at risk of getting it. I'm sure you've heard this, like there are some ethnic minorities where unfortunately, because of where you're from, it puts you at risk of, getting hypertension. So people like Africans, Afro-Caribbeans, like a lot of Black people, South Asians as well, they are at risk of getting hypertension. I was trying to look into why that is because I was like, okay, that's not really fair,
Yeah.
But it was mostly because of our lifestyle. That's what I realized. That's why most minorities are at risk of hypertension is our lifestyle. We need to do a lot better when it comes to our lifestyle. Also, sometimes it depends on like the area you live in. So if you live in a deprived area, obviously you're not going to be living as well as someone who lives in like a well-off area. So again, putting you at risk of getting hypertension because you're not eating well, you're just not in the right environment. One thing as well that I always stress on, which I've literally just mentioned, is stress. Stress is a major factor when it comes to hypertension. Like a lot of
Yes.
people don't realize, like you may be someone that is probably healthy, you exercise, you eat like your fruits and vegetables, you're probably like an ideal weight. But if you are under stress, you may realize that, okay, maybe, you're getting some hypertension. Like, you go to your doctor, they're like, oh, your blood pressure is a bit high, and you're wondering
Yeah.
what is going on. It's probably because you're under a lot of stress.
Yeah.
So, yeah, stress, I say, is a major factor. Like,
It is.
it really is. I can't put a lot of emphasis on that. So people
And not
need to
just
try.
hypertension, a lot of
Yes,
things
for
as
a
well,
lot of
isn't it?
things.
A lot of
Yes.
things. Hypertension is one of them,
Yes.
but stress is the cause of a lot
Stress.
of things.
Exactly. So make sure you relax. You go on that holiday. Honestly, it's something that would help you.
Chase the
So
sunshine.
yeah, honestly,
Chase the
yeah,
sunshine.
definitely. So when it comes to like risk factors, I would say these are the major risk factors of like getting hypertension. Sometimes too, there are some medications that can, increase your blood pressure. So if
Yeah.
you are someone, let's say for instance, you're on contraceptives, you're on HRTs, these sort of medications can increase your blood pressure. So you may realize that when you're on contraceptives or HRT, they usually call you in for a pill check or a HRT
Yeah.
check, and then they do your blood pressure. That's because these medications actually increase your risk of getting hypertension because they increase your blood pressure.
Yeah.
There are other medications as well, immunosuppressants, steroids, those sort of things that can also increase your blood pressure. Trudy, do you want to mention some few if I haven't missed?
So there's quite a lot. There's quite, I think, a lot of
Yeah,
medication that can actually raise your blood pressure. You
yes,
have mentioned most of them.
mm,
And just to also emphasize on this, I
yeah,
don't know about you, Steph, but I find this with a few of my patients in my clinic where say I've called them because they've requested their regular, I don't know, their regular contraceptive pill, and I'm just
yeah,
going through a medication review with them, just check, and then I say, oh, do you have your blood pressure reading? Do you have a blood pressure machine at home? They're like, why would I have that? And I'm like,
yeah,
can we get your blood pressure reading? And they come to me like, look, I'm not on blood pressure medication. What are you on
yeah,
about? And they
yeah.
get really agitated at you.
They
But there is a
do.
reason for that. Like they are like,
Yeah,
hold on, you've got the wrong patient. Like I've
yeah,
had that so many times where patients have come
yeah,
and said, you've got the wrong patient. Like I'm just asking for the pill. Just send the pill.
yeah,
And
yeah.
I'm thinking, I'm actually just trying to watch out for your health here. Okay. We're just trying to make sure your
Exactly,
blood pressure is okay,
exactly.
So
Yeah,
like contraceptives, some contraceptives, especially those that contain estrogen, can actually increase your blood pressure. Um,
yes,
and especially to women who are predisposed to hypertension, they will almost certainly cause high blood pressure.
yes.
I think you've mentioned most of them. You've said NSAIDs, which are,
Oh yeah,
very commonly associated with a raised blood pressure. So the
yes.
very sort of like common ibuprofen, naproxen, which a lot of people, or like people will jump on ibuprofen, naproxen like
Yes.
there's not tomorrow, but they don't realize these things. So those can
Yeah.
definitely they can certainly increase your blood pressure.
Yes.
Steroids, or corticosteroids, I think you probably mentioned those. Immunosuppressants,
Yes.
some antidepressants also can cause high blood pressure. So if
Yeah.
you're on antidepressant, it depends which one. It's mostly the TCAs and the MAOIs
I
that
always
can
do
raise
that.
your
So
blood pressure. The
yeah.
monoamine oxidase
Yeah.
inhibitors. So you might not know which one it is that you're taking. So what I'd advise is, if you're on antidepressants, just get maybe a regular blood pressure
Pressure.
check.
Yeah.
And if you're not sure which one it is that you're on, or if you should even be watching out for some of these things, always speak to a healthcare professional. Also, some stimulants can cause a raised blood pressure. So
Yes.
medication for ADHD can also increase heart rate and also blood pressure. So if you're on any ADHD medication, it is important just to get your blood pressure checked as often as possible.
Yeah.
And I think the only other one I can think of is some herbal supplements. And I
Mm.
get a lot where people are like, I'm only on, I don't know, ginseng or something, so that should be okay with my with my blood
Mm.
pressure medication. I'm thinking, listen, we've not done studies. There's no studies out there
Yeah.
done on like herbal supplements, so we can't speak very highly on them. But I always
Yeah.
say sometimes it's just best to prevent some of these things, especially if you don't know what impact that would have on your health, because some supplements have been shown to increase blood pressure in some patients. But I
Yeah.
think you've probably mentioned all of them.
Yeah.
You did say a point though, and I just want to add on to that. So you know how the some ethnicity groups are at high risk of hypertension. You know, blacks, Afro Caribbean,
Mm.
South Asians. Now, it could be, of course, the just our way of life. Say there, one of them, our way of life, or just
Yeah.
the way we, I don't know, our diet and all of that. But I think part of it is also our genetic build-up,
Mm.
like just the way we are, just the way we are built. It's the same way like black women have, say, higher estrogen levels than other ethnicities. So I think some of
Mm.
these things do play a role. I haven't read much about it, but I'm just thinking about it
Yeah.
because, there's this saying. There's this saying, you probably have heard it. You know when people say, oh, black people have got heavy bones?
Yes.
That's why we can't swim, right? Now, I'm not saying that is a thing, and I'm not saying this has anything to do
It
with what we're
could
talking
be.
about, but what I'm trying to say is we're all built differently, okay? And each
Yeah.
ethnicity is very different. Like we all have very, very different genetic makeup. So
Mm.
I think some of these things could also be the reason that some of these things happen.
Yeah.
But
That's true.
it's something I think we need to really
Yeah.
dig deep in and just read on, because it
Yeah.
is it is unfair.
It
It is
really
unfair.
is. It's not fair.
Yes, it is. It is unfair.
Yeah.
It's unfair.
Yeah.
There is certain groups that are at increased risk of developing high blood pressure. I know we've said like
Mm.
women who are on contraceptives and maybe they're
Mm.
predisposed to hypertension. So if it's like they say an Afro Caribbean woman or an African woman who is on
Yeah.
contraception, so she would be more likely, for instance, to have high blood pressure than maybe
Yeah.
someone else in a different group. But what other
Mm.
groups, Steph, are there of people who are at increased risk of developing high blood pressure?
So one major group that I would say is like pregnant women.
Mm,
What people realize is that a lot of pregnant women do go for the checks, and they have realized that when you're pregnant, you are at
yeah,
risk of like getting high blood pressure, which can lead to like preeclampsia, that sort of thing. So
yeah,
that is like a major one when it comes to that. So if you are someone that's pregnant, please do go for your regular blood pressure check, because
yeah,
it is literally a lifesaver, because it goes like loads of risk, loads of other injuries as well if you don't get it managed. Yeah. I think we've mentioned some of them already. Like if you are someone that's immunocompromised, let's say for instance, you're on some medications that suppress your immune system, that sort of thing, it could put you at risk of getting high blood pressure. So those are
yeah,
one of like the main groups. We also mentioned the age, which is the elderly. Those
yeah,
are, yeah, elderly patients are also at risk of like getting high blood pressure, only because with age your body changes and your heart begins to work a lot harder. So I would say patients over the age of 65 are like, major risk of like hypertension. So those main group, like, I know there are some young people as well that are getting like hypertension. If like most of the time, I would say if like you are a young person using all these drugs that you shouldn't be using, that puts you at risk of hypertension. So please, if you are using drugs that you shouldn't be using, get your blood pressure checked, because it'll put you at
Yeah.
risk of a lot of like cardiovascular diseases.
Yeah.
Another groups as well, let's say for instance patients with kidney problems, with diabetes. These are all factors that increases your risk of getting hypertension. Especially if you have kidney problems, it makes your heart work a lot harder as well.
Yeah.
There's a lot of imbalance of like hormones, of electrolytes, which all puts you at risk of getting hypertension. Diabetes as well, like, puts you at risk of getting hypertension, because diabetes, I think of it this way: there's an increased amount of glucose in your blood. So therefore, it's going to make your blood very sticky, which is causing a lot of resistance. It's going to make your heart work a lot harder. So again, increase your risk of getting hypertension. So yeah, and maybe you're just someone that has like maybe a heart condition or something, maybe you were born with like a heart defect or something. Again, that will put you at risk of getting like hypertension. So these are some of like the groups of patients that that are at risk of getting hypertension. Do you have any more to add, Trudy?
I think you've actually mentioned all of them that I can think off the top of my head. You've mentioned also, I think previously, or maybe you've mentioned it now as well, people who have unhealthy eating habits.
Yeah, previously.
People like that
Yes.
would certainly be at risk of developing high blood pressure or hypertension.
Yes.
But yeah, no, you've actually mentioned all of them. I can't think of any others. But I
Yeah.
think as well, because it can be genetic. So if your parents or your grandparents have hypertension, high blood pressure,
Yeah.
they have hypertension. So I think people like that would be also at risk of developing high blood pressure. So it's also just worth knowing your health history, your family
Yes.
history, just making sure that you're on, you know everything that there is to know, so that if you're offered a service like a blood pressure check, you're
Yeah.
able to get that check, just to make sure that you don't have hypertension.
Yes. Yes. So we've spoken a lot about what hypertension is, the risk factors, that sort of thing. We did say it is a silent killer. But what kind of things would you like? There are some sort of signs as well, which may indicate that you are on the verge of getting hypertension. What sort of signs do you normally, like red flags, do you normally tell like your patients? Um,
To be fair, as we said, hypertension is what is known as a silent killer. So there wouldn't be any specific signs you should look out for. But just as a general rule, what I say to patients is, if you're having any new symptoms, any unexplained new symptoms that have been going for a while, I'm not talking like all of a sudden your leg is hurting, your calf is hurting, then you're like, this
yeah.
is probably happening. Any new symptoms that have been ongoing for a while, it is
Yes.
worth maybe getting that checked. Because to be fair, when you go to GPs with, let's say, an unexplained new symptom, it is more than likely that your GP will check your blood pressure
Yeah.
and, of course, every other thing they need to check. So if your blood pressure is elevated, this would warrant them doing extra checks. And then in most cases, they do they even give patients like a blood pressure to just go home with, and then you do your blood pressure for 3 or 7 days, depending on what they've
Yeah.
asked for. And then that would, of course, be an indication of whether you have hypertension or not.
Yeah.
There isn't any specific signs that we tell patients to necessarily look out for, but it's just any new signs. If you've been having say a headache that has not been going, you've tried everything, it's not going,
Mhm.
maybe get that checked. And especially if you're in one of these groups that are at risk of developing high blood pressure, it is
Yeah.
worth that, you know, when you have a new symptom that you know is unexplained, you've not had before, it just come from nowhere, it's been ongoing for a while, just get that checked, and also make sure
Yeah.
you get your blood pressure checked.
That's right.
But I don't know if, Steph, there's any patients who've come to you and they've had certain symptoms, and you're like, oh my God, like this is, you know,
Yeah,
an
I
indication.
think as you mentioned, like there's not really a specific symptom that would actually tell us that, oh, okay, this is a symptom of hypertension. But what I mean, something that my brother went through is that he consistently was having like headaches, as you mentioned, and we just thought, oh, okay, it's just like, you know, him like having headaches because he's stressed, that sort of
Yeah.
thing. Then he kept on getting it, and paracetamol was not working, like all these painkillers were not working. So
Yeah.
because what's it called, my like we do have family history of hypertension, so it just dawned on him, okay, let me just check my blood pressure as well. So he checked his blood pressure, and actually it was really elevated, and now he's been diagnosed with like hypertension. And what he
Yeah.
realized is that anytime his blood pressure is high, what he normally gets, he actually gets a headache. And that's how, yeah, that's it. And so sometimes it's his own fault. But let's say, for instance, he hasn't taken his blood pressure pill, he
Yeah.
actually gets headache. That's his sign. I think that's
Mhm.
just his sign. Yeah, he gets headache. So, but once like maybe he's taken his blood pressure pill, he's actually okay. So I think
Yeah.
that's just his symptom. But as we said, every individual is different as well. With hypertension, there's not really like a symptom per se. But if you are
Mhm.
someone that suffers from like hypertension, do listen to your body. Any new changes, as Trudy mentioned, do like seek for help. So that's something that I would say. Yeah, it was just their headache that I would say like
But
probably is consistent with hypertension. Yeah,
that makes sense though, if you really think about it, if we like just
yeah,
look at something scientifically, right? So
yeah.
we know that when blood pressure is elevated, the blood vessels normally constrict or
Constrict.
dilate,
Yeah,
right? So that
Co-
happens as well, I'm supposed to the blood vessels in the brain. So they are
yeah,
probably constricting and
yeah.
dilating abnormally, and that is causing a headache. So
Yeah,
it is possibly one of the signs of
yeah,
hypertension, if it's persistent, of course.
yeah,
Some of it, of course, some headache can be because of other things like stress, or I don't know,
yeah.
you banged your head or something. But if it's just come out of nowhere, it does make sense that this could actually be hypertension.
No, it's actually true. And actually, coming to think of it, it's not just my brother that has actually
Mm.
mentioned headache.
Yeah.
Unfortunately, I know someone that actually passed away as well, and it was honestly, it was due to elevated hypertension, and obviously, it led to something else. But
Wow.
it was later on that we realized that he kept on complaining that, oh, he's always got headache, always feeling a bit weak. But
Yeah.
you know, sorry to say, these are people back home. Sometimes they can be very ignorant about their health, and they won't get it checked. So, and obviously he was a young guy as well. He was in his
Mm.
30s. So people are saying, okay, just because you're in your 30s, I can't get
Yeah.
like, high blood pressure. But sorry, it
Yeah.
doesn't matter if you're 30 or
It
not.
doesn't pick an
If you're
age.
if you're getting some symptoms here, do get yourself checked. But I think he brushed that off, and he kept, oh yeah, headache, probably go away. I'm probably working too much, that sort of thing.
Yeah.
And
Oh no, that is quite
unfortunately,
sad.
yeah, that actually led to something else. We actually don't know what happened, but we think he had like a heart attack because
Mm.
we actually think he had a
Yeah,
heart
like a
attack.
cardiac
Either a
arrest.
heart attack or probably like a stroke or something, but we still don't know what the cause was. But
Mm.
come to think of it, his wife was like, yeah, he was getting headaches and stuff. And one time he went to check his blood pressure, it was high, and still nothing.
Nothing. See,
Like,
do you know what? Like that it upsets me, but it saddens me as well.
yes,
It's because we as Black people, as there's some conditions that we're predisposed to, right?
yeah,
So if you're having elevated blood pressure, even 3 readings of elevated blood pressure, that is a sign. Like, go get
yes.
it checked or go seek. Like I actually know a friend of ours. I'm not gonna say her name just in case she hasn't told you, Steph. But I know a friend of ours who, like, she's young, and
Yeah.
she was diagnosed with hypertension like 3 years ago, but that was, I think, after she'd had after
Giving
pregnancy, and it
birth.
just
Yeah, it
yeah,
normally.
and exactly, she's on medication for hypertension, but it goes to
Yeah.
show, like, it doesn't actually pick on age, on who you are.
Yes.
It could be healthy as well, but if,
Yeah.
say, it's a genetic thing for you, you will possibly get it. So just get it
Yeah.
checked. That is quite sad.
Exactly. I know. Honestly, people shouldn't be ignorant when it comes to their health. Like, it doesn't matter
Yeah.
whether you're young or old. Like, if your body is telling you, oh, there's
Listen
something
to your
wrong,
body.
get it checked.
Yeah.
Get it checked. Like,
100%.
and
100%.
honestly, and I think we always say this, men tend to keep things to themselves as well. You
They
know?
do. They do.
They tend to keep things to themselves, and
Mm-hmm.
it's not good. If there's something wrong
No.
with you, complain.
Yeah.
If you're complaining too much, it doesn't matter. At least somebody is
Yeah.
gonna hear you, you know?
I think, do you know
So,
what? I think part of it as well is, especially Black men, they like to be
yeah.
seen as strong, right? So it's almost
Yes.
like you going to the doctor, you being on a medication,
Yeah.
it's almost like a sign of weakness, but it's
Weakness.
not. It's just your
Yeah.
body not, it's not doing some things that it should be. It's not even anything you can control. But I think there's
Yeah.
that mindset of, like, if I'm taking medication, I'm weak. If I am going to
Yes.
my doctors because I can't control I should be stronger than my body. My mind should
Yes.
be stronger than my body, So if I ignore it, or if I do XYZ, I should be able to just push
Yeah.
away. But that's not the case.
Yeah. To be honest, yeah, I kind of like hold my hand up to this. Sometimes I do say, let me sleep on it. I'll probably get better.
I do too. No. Do you know what though? Do you know what? My problem is I have a high pain threshold. So something could be really bad, but I'm
Yeah.
like, I mean,
Let me
I
sleep on it. I'm sure
and
by tomorrow it'll be fine.
I'll be fine. And you know
I'm
what? I think
guilty.
it doesn't help, Steph, that we're
Yes.
pharmacists. So most of the time
Yes.
we self treat, right? So you're
Yeah.
like, okay, what's going on? I can just take this and I'll be fine.
Yeah.
But I think it also applies to us. This should also
Yes.
apply to any
It should.
healthcare
Yes.
professional, any healthcare workers. If
Yeah.
anything is wrong, get it checked, because
Exactly.
we're just as bad. We're literally
We are.
we're just as bad. But
We are. Yeah. Honestly.
they say
Yeah.
acceptance is the first step. So we know that this is, so the fact that
Yeah.
we know this, at least it's something we can work on.
Yeah. Okay. So we've mentioned a lot of like the causes, the risks, and the risk factors when it comes to hypertension. So let's move on to ways in which we can prevent and help manage hypertension. Should we start? Let's start off with like the treatments, like briefly mention like the treatments of hypertension.
Okay. So I think to start with, you did say lifestyle and medication. So lifestyle
Yes.
is normally actually considered as the first step. So most patients, you probably I've heard this 10,000 times, Steph, when you say to a patient, well, we want to put you on a blood pressure medication, they're like, well, can I not do anything else? And we offer lifestyle,
Yes.
just because most people don't want to be put on new medication. So lifestyle is
No.
always the first medication, the first treatment.
Yes.
So lifestyle changes. So all the things we've mentioned previously. So healthy diet, weight management, regular exercising. And we always say literally just 30 minutes of exercise 5 days a week is
Yeah.
enough to actually lower your blood pressure. And it doesn't even have to be like heavy exercise. People think that when
Yeah.
you're saying regular exercise, you're talking like they need to be
Going to the
running,
gym,
treadmill 10 minutes,
pump.
rowing, weightlifting, 500. No,
Yes.
no. It's literally supposed to be
Yeah.
anything you can do. If you can do like 10 minutes of even
Just
just skipping
walking.
and then
Yeah.
10 minutes of like something else, it's just whatever you can manage. Even
Yeah.
just even just 30 minutes of walking. That is
Yeah.
actually enough. You know, I'm not talking about walking leisurely, like you to walk 2 steps, you stop and enjoy the nature, take pictures, keep walking. I mean, it's still good, but
Like a brisk
just
walk.
yeah, put yourself out there
Yeah.
like, okay, I'm going for a walk now, this is for me.
Yeah.
And you actually walk for half an hour. Just light exercise
Yeah.
is also very beneficial. And you've also mentioned, you know, limiting, of course, alcohol intake, you know, stopping smoking, or at least cutting down on some of these things like smoking and
Yeah.
alcohol. And of course, reducing stress. So I say
Yeah.
reducing stress, but that is a difficult thing for a lot of people, isn't it?
Yes.
Because just thinking about what causes stress is stressful enough. So you having to try and work that out is yeah. But some of these things is literally the first treatment or the fast way of managing or even treating hypertension. And also just enough sleep. I am very guilty of this one. Okay, I'll be very honest. Like when I'm working, and I'm not when I'm actually, you know, in my work mode, I'll work, like I'll manage 5 to 6 hours of sleep a night and I'll be fine. Well, I think I'm fine. I'm clearly not, like, but
You are
not
literally a workaholic, honestly.
I know. And it's not correct. It's terrible. It's wrong. I know.
Yeah.
Steph, how many hours do you manage?
You know what? It depends. You know, some days I'm like you, where I would probably manage on a 5 to 6 hours sleep because I was probably like watching like something and like it's my own fault. Yeah. But sometimes I would say I get a good like 8 hours sleep.
That's good.
Yeah. Because I do need to wake up early because of the kids, but
Yeah.
when they go to bed, I am getting ready to go to sleep as well. So when they're in bed at 8 o'clock, I'm getting ready to sleep as well.
That is good. Good for you.
So sometimes even more than 8 hours.
You're already taking steps to minimizing, you know,
yes.
your, potential hypertension.
Yeah.
You're on the right path. I say, so when I'm working, I do this, but when I'm on holiday, I will do 8 to 10 hours. They say you can't sleep enough. I'll do even 10 hours if I have to. So, to be honest, enough sleep is very important.
It's very,
Don't listen to my stories and be like, look, Trudy, no. I'm not saying do 5 to 6 hours. It's very important to manage enough sleep. So 7 to 8 hours a day of quality sleep every night is actually is really important. Now, you could be 10 hours, but it's interrupted sleep. That's not enough. It has to be quality sleep every night. Yeah. So this is like the first, I would say this is like the first treatment for hypertension. And then if, of course, you've tried this and your hypertension is still elevated, then we can go for the drug treatment, so medication.
Yeah.
Now, the reason a single hypertensive medication that would be adequate for sort of like management of hypertension, they actually say that additional hypertensive drugs is normally what would be used to control high blood pressure, or at least to achieve a certain sort of target. But also, it's very important to note that there isn't a specific group of medication that is tailored, that would be used for every patient, because it is a tailored approach where one drug might be suitable for a certain patient and another drug might not necessarily be suitable for a different patient. Now, when it comes to hypertension, we actually treat hypertension looking into, of course, age as well as ethnicity. So and also if you have type 2 diabetes, so patients with type 2 diabetes or patients who are over the who are 55 or under, and they're not of the ethnicity groups that we talked about. So they're not Black, African, or Afro-Caribbean, would be treated using the same stepwise treatment. So they would start with something like an ACE inhibitor, and then of course it would be the addition going forward.
Yeah.
And then of course now patients who are not who don't have type 2 diabetes, and they are over the age of 55, or even patients who are of the African origin or Afro-Caribbean origin, or even South Asian, they might be treated using the same sort of stepwise treatment guide. So it all just depends again. But again, saying this is not really a guarantee that you are African and your friend is I don't know, Indian, your same age, that you'll be on the same medication, because you might tolerate that someone else might not tolerate. So it is really a approach when it comes to hypertension. But just very briefly talking about some of the very commonly used medication. So we have the likes of like the diuretics. We a lot of patients are on diuretics and they know about diuretics because they call it water tablet.
Water tablet.
Yeah. So a lot of patients will even ask for the water tablet. Why can I not get a water tablet? What it does is, it's actually, the name really describes it. It actually gets rid of excess water and sodium, which of course helps lower blood pressure. So if you're on the likes of furosemide or benflumethiazide, these are diuretics. So this could be a treatment for you. But again, it always has to be what is correct for you. So always speak to a healthcare professional before going on some of this medication. Also, there's ACE inhibitors, which is the likes of the lisinopril, ramipril, which are the most common ones. There is angiotensin 2 receptor blockers, which is the likes of losartan. There is also medication like calcium channel blockers, which are also very, very popular, and they're used widely. The likes of amlodipine or diltiazem fall under this group. And then there's beta blockers, which are also used for to manage high blood pressure. So the likes of atenolol, propranolol, these are beta blockers. And then there's also alpha blockers and renin inhibitors. So depending on what medication is suitable for you and what adult step is suitable for you, you'll be put on the correct medication. But it's very important to, I think, emphasize that not all medication will be suitable for everyone. So some people don't tolerate certain medication. So if you're not tolerating certain medication, don't just stop taking it. And you probably have come across patients like that, where they stop taking medication because they had side effects, didn't tolerate it. It was causing, I don't know, swelling in their ankles, and so they just stopped taking it. No, that's not the correct approach. If the medication is causing you side effects, if the medication is not suitable for you, if for some reason it's having interaction with maybe certain medication that you're on, speak to your doctor, speak to your healthcare provider, let them know this, because there is going to be something that would be suitable for you. Yeah,
Definitely. Fantastic. So you've really mentioned a lot of like the treatments that's commonly used. I think one thing that people need to understand is what you mentioned. Each treatment is tailored to the individual, and there isn't just one drug for everyone. It's not like all size fits all. No.
that's it.
You honestly, there are some people that maybe one medication could manage their hypertension, but there are others that where they may need different of the medications, like they may be on 2 or more of the hypertensives. So every individual is different, as Trina mentioned. So don't watch your sister or brother thinking, oh, okay, my brother is on one medication for hypertension, so therefore I should be on one medication as well. No, that's not the case. Every individual is different, and you may be on 1 or 2, depending on your blood pressure.
And I think also just mentioning that whole everyone is different, the same numbers we're talking about in regards to what hypertension readings should be, the 120 over 80, it doesn't actually always apply to everyone.
Yes.
So also just know that just because you're, I don't know, you're finding that you have different reading to say your sister, your cousin, your friend, doesn't necessarily mean that maybe you have hypertension or they have
Yeah.
hypertension, because everyone's blood pressure reading is actually so different, you know.
So true.
It's very surprising, but it's very common, because my
Yeah.
sister, I didn't know this until I was at hospital with her. I think it was my nephew, when my nephew was born, and the nurse must have come into the room and did her blood pressure, and she must have said a number like 105 over something. And I was like, hold on, like that is very low for someone who's just had a baby, right? But my sister looks at me and goes, no, that's actually normal for me.
Yep.
So
That is so true. Yeah.
yeah, so it is very important to know some of these things. Just know what your readings are.
Yeah.
Like for me, my readings always like 120 something over 80 something. So if I had 105,
I'm with your sister.
I need to take some pseudoephedrine to bring it up, because something is not right with me, you know?
I'm with your sister. Listen, yeah, my blood pressure is always low. And that is me. Like, even the doctors have come to understand that my blood pressure is low. You know,
Yeah.
so, I'm not sure if we did mention, like, so the ideal blood pressure should be 120 over 80, but the normal pressure, like, range is 90 over 60, between 90 over 60 to 120 over 80. So mine tend to be on the 90 over 60 range, yeah? And I accept that, okay? Sometimes it may go a little bit lower, but let's not watch that. So far as it's between 90 over 60.
Exactly.
My doctors are fine with it, yeah.
That is normal for you.
That is normal for me. Exactly. But
see, now
you
if
know,
mine went that low,
don't be pumping adrenaline.
no, they need to pump me with some pseudoephedrine, because this is not right. I'm dying.
No. That is normal for me. Like, I've come to accept it. My blood pressure is low, but my heart rate, on the other hand, yes. Yo,
really?
my heart rate is high. My heart rate is high. It's so high, and you know that is my normal pressure.
That is normal for
come
you.
To us.
Yeah,
it's normal
see,
for
now,
me.
If you had a blood pressure of say 120 over 80, that would be considered elevated for you. We need to do more. Like, we would need to do a few more tests just to see what is going on, because that is elevated for you.
What is going on? Any changes? Like, what's going on at home?
Yeah, like we need to like start putting you on some diuretics.
No, but speaking of that, it's true, you know, like, as we said, every individual is different, and with the doctors, they check different factors as well, because I had an aunt, I'm not sure if I told her, I had an aunt, yeah, who she kept on checking her blood pressure, and it was, I think, 138, or it wasn't 140 over 90, yeah, but it was on the borderline, and it was consistently high. And the doctor looked at like her risk factors, different things, like her family history, like there was family history of hypertension, other cardiovascular diseases. Looking at her as well, no offense to my aunt, like she was overweight, like, you know, there were so many different factors, and looking at all of that, the doctor decided to put her on medication, because you know, she was at risk of, like, she was at that stage, I think they call it stage 1 hypertension, where like, you know, she needed to go on these medication just to help, you know, bring it down a little bit. And then and honestly, it's been helping her, because some people think,
that's good.
yes, they need to have like a reading of 140 over 90 before they are diagnosed with hypertension. But sometimes, you know, you could be consistently on that stage where you're getting 130 over 80 or something and higher, but not actually getting the 140. And and to be honest, eventually, like, before she was started on the blood pressure pills, although she was getting 130, eventually it kept on creeping high and high and higher. It got to 140, got to 150. And that's why it started off as 138, like 138, and eventually it kept on creeping up It kept on creeping up, yeah. And that's when they were like,
Wow.
no, you need to be on on the medication. Yeah.
Like,
Yeah.
honestly, blood pressure checking is so important. It's so
Exactly.
important. Especially if you're these
Exactly.
groups, risk groups, it's so important to check your blood pressure. You
Yeah.
don't realize how important it is.
Yeah. It really is.
Yeah,
It really
but
is.
we have. Do you know what, Steph? We've been talking about like getting your blood pressure checked, and we forget that not everyone actually knows where they can get their blood pressure
Oh
checked,
yeah.
especially if they don't have a blood pressure machine at home, because a
Mm-hmm.
lot of people don't actually have a blood pressure machine at home.
Yeah.
I am lucky enough; we always have one at home. I'm sure you have
Yes.
one as well, Steph.
Oh, definitely.
Exactly.
Yes.
But
Yes.
it's
Yes.
not everyone is actually either able to afford one, or maybe
Yeah.
they just don't really see a need for it.
Mm.
We're not saying guys go out there buy the blood
Mm.
pressure machine. By all means, go get yourself a blood pressure machine.
Yeah.
We're not saying no, but
Yeah.
if you need to check for your blood pressure, you can't in the UK. Adults over 40 are now being advised to get their blood pressure checked at least every 5 years, especially if
Mm-hmm.
they don't have any diagnosis of hypertension or high blood pressure. So people of certain ethnicities, which is what we've talked about, the Afro-Caribbean, African, South Asians, may have blood pressure checked at a younger age, just because of, of course, being at risk of high blood pressure, and they would
Yeah.
probably need to get it checked even more regular. So
Mm-hmm.
if you're wanting to get your blood pressure checked in the UK, you can go to a regular chemist or pharmacy. Chances are they have that as a service where you can actually get
Mm-hmm.
your blood pressure checked.
Yeah.
Or your GP surgery. Most GP surgeries now have a blood pressure machine outside where you can actually, not outside the surgery, but in the waiting area,
Yeah.
where you actually just use it yourself, and you can get your blood pressure checked. You can even give it to a receptionist to add onto your records, just so
Yeah.
that is always on your record. So if there's ever anything, your GP knows what your blood pressure what your blood pressure readings are, or you can actually just take it home for your own records. And also some workplaces. I know a lot of workplaces now that are offering blood pressure checks, and also just health, I think full health checks. I think workplaces are getting
Mm-hmm.
really into that, where they offer this as opposed to the bonus that most people get. Or maybe they get both. I don't know. I don't get offered anything, okay? But some people get offered this in their workplaces, where they get like a full
Yes.
health check. If this is being offered in your workplace and it's not costing you anything, honestly, go for it.
Yes.
Go for it. Like, this is insurance, and my boyfriend always says to me, there's nothing better than free insurance, and you can't get enough free insurance. So this is free insurance. So
Yes.
if it's being offered in your workplace, go get it, get it done. If it's the full
Mm-hmm.
health check, if it's just a blood pressure check, go get it done. It's very,
Definitely.
very important.
Yeah.
So I think we have basically just talked about everything that there is to know. What would your take-home message be, Steph, in regards to hypertension?
Okay. So I think, as we mentioned, hypertension is so common and it's affecting millions of people worldwide. It is, as we mentioned, a silent killer, and if left untreated, I think it will cause loads and loads of problems. It can put a lot of strain on your organs, your heart, your kidney, your
100%.
brain, your eyes, which can be really potential to your health. It can lead
Yeah.
to stroke. It can lead to different heart diseases, heart attacks, like so many potential fatal diseases. So when it comes to hypertension, do not take it lightly. Do go for your checks. Honestly, if you can afford a blood pressure machine, do get a blood pressure machine and do check your blood pressure at home, because it's better to be safe than sorry. Like, when you catch something early, it's better that way. So if you can, get a blood pressure machine at home. If not, as Trudy mentioned, check at your local pharmacies, your GP surgery, or go for your NHS health check, if you are the age of over the age of 65, which is free for people in that group. So that's one thing I would say. Do not take it lightly. Make sure that you're doing your regular checks. We did mention the risk groups as well. Hypertension, as I mentioned, is mainly caused by lifestyle. So check your lifestyle. If you are someone who is overweight, not eating healthily, eating a lot of fatty foods, not eating fruits and vegetables, being inactive, these are all major factors to getting hypertension. Also,
Yeah.
if you do smoke, you drink caffeine, you drink alcohol, these are major risk factors to getting hypertension. Unfortunately, being an Afro-Caribbean or African or South Asian as well are risk factors to hypertension. But with every lifestyle, there are changes that can
Yeah.
help us, prevent and manage the disease. So
Yeah.
please look at your lifestyle and do watch the things that can help you prevent you from getting hypertension. Um, One thing that I would also say you should take home is that when it comes to hypertension, the causes of it could be due to medications. So please do watch the medications that you are on. As Trudy was mentioning, like so some over-the-counter medications such as pseudoephedrine, which are in like cough syrups, cold and flu remedies. Please do watch that. So talk to your pharmacies before you buy these medications. Do watch like the medications you're on as well, because sometimes you may be on like some medications that interact with certain medications which can increase your blood pressure. If you are on contraceptives, HRT, these are all medications that can cause hypertension. So do watch the medications that you're on. When it comes to prevention and management, as we said, each treatment is tailored to the individual. There's not a one medication that works for everyone. There are different sorts of hypertensives out there, which essentially their main goal is to help relax the blood vessels,
Yeah.
dilate it, make the heart work a lot, not a lot, make the heart work a bit hard, not too hard, but so
Yeah.
that your blood vessels is not too restricted, so that the blood can flow a lot better. So these medications essentially work together to help reduce your blood pressure. So you may find out that maybe you're just on one medication, but someone may be on several medications because they're on
Listen.
different medications that work in different ways to help manage the blood pressure. So do not look at your fellow brothers and sisters saying, okay, he's only on one, so why should I be on two or three?
100%.
Every individual is different when it comes to treatment. So each treatment will be tailored to yourself. And all in all, if you have any doubts, always speak to your healthcare professional, always speak to a doctor, a nurse, a pharmacist. They are there to give you that advice. And if in doubt, do your research, as I always say. Yes. And what about you, Trudy? What would be your take home message?
So we have said that high blood pressure, also known as hypertension, is a very common but serious medical condition. But listen, it is manageable, guys. With lifestyle changes, which is what we've literally emphasized on so much, and of course, appropriate treatment, we can manage this condition. It is not the end of the world. Some people think, oh my God, I've been diagnosed with hypertension. How am I going to cope? No, you'll be fine. It is not the end of the world. But what I always say, and I think this is something I'll emphasize on even more after I found out my sister's blood pressure, and now Steph has told me hers is
Yeah.
exactly the same, is always know your numbers. Always know what your
Yes.
blood pressure reading is. So regular blood pressure monitoring is essential for early detection and management of hypertension, but also understanding your blood pressure readings and working with a healthcare professional to establish a good sort of like target goal is very crucial.
Yeah.
And the reason I say this is, so for someone like Steph, you will not go for the same, or you'll not be given the same goal as another patient who say regular or normal blood pressure is normally 120/80. So it's very important to know your numbers so that you know that this goal, that the target goal that is being put down for your blood pressure is actually what is right. We've emphasized on lifestyle modifications, so it's very important to I think just generally, a healthy lifestyle is always advised. Now, people do a mistake of, all of a sudden they want to change completely everything. Someone who's not been drinking water wants to do 5 gallons or 10 liters of water in a day. That's not actually going to do you any good. If anything, that could actually do you worse. So that could actually elevate your blood pressure even more. So drinking excess water, or up to sort of like 2.5 liters, is good, but overdoing it is actually not really what your body needs. So just have just do everything in moderation, right? Because what happens is when you drink so much water, your heart is working a lot more as well. So you're actually giving your little heart so much more work, and what's happening is it's going to increase your blood pressure, it's going to lower your heart rate, there's going to be even things like kidney dysfunction, and even you could have even water in your brain, cerebral edema. So there's things that can actually happen with overdoing something. So we're not saying all of a sudden change everything, no more alcohol, no more, fizzy drink, it's just water, and now you're doing 10 liters of water. No, do it in moderation. Know what your limit. Someone could be doing 2 liters and that's normal for them. Someone could be doing 2.5, 3, 4. That's normal for them, depending, of course, with how active they are and things like that. So things like that is very, very important to note down. So just know what your limits are. That will actually help you not just change this temporarily, but make this a lifestyle change. So it's not just for 1 week you're drinking 2 liters of water, or you're drinking 4 liters of water. The next week you're down to basically droplets. So just make it a lifestyle change. And my final point, which is normally very important, and I say this to all of my patients, is medication is not something you decide to take today and then tomorrow you decide, what, I don't feel like taking medication, or I'm a little bored with this medication. Why do I take medication? And then next week you remember one day you take it. Medication adherence is crucial to managing your blood pressure. A lot of patients don't realize how important it is that you take a medication as directed, as advised, the times it has been advised for you to take it, because this will be very crucial in managing your blood pressure. So if you've been put on blood pressure medication, make sure you're adhering to this. So you're taking it every day. That is the direction. You're taking it every day. You're not missing any doses. If you find that you're not able to keep up with sort of taking medication every day, speak to someone. We always say speak to a healthcare professional, because they're the people who give you advice on what to do or how to manage certain things. So it's very, very important that you take your medication as directed, as prescribed, and always speak to a healthcare professional. And we have emphasized on making sort of the management of hypertension and a personalized sort of journey. So what medication you're on, or what changes you're making to your health, doesn't necessarily mean, or doesn't necessarily apply to the other person who might be suffering from or might be having hypertension. So just bear that in mind. Don't compare your health to someone else's either, because we're all so different. We have so far, that's one common thing that we have found in a lot of things. We're all so different. And as much as managing hypertension can or is basically a lifelong journey, which literally requires commitment, it is manageable with, of course, the right lifestyle changes, the right modifications, and the right treatment. So fear not, because as long as you're putting your health first, as long as you're making the right changes, you're on the right path.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.